Despite being caught in the grips of the Omicron variant, the nation's largest school district says in-person learning will continue after winter break. New York City's mayor made the announcement saying the city's schools are safe and kids learn best in the classroom. All right, let's go to BNC's Dray Clark. He is live in New York with the latest. Dray?
Tashanea, good afternoon. 1 million children attend the New York City Public School District. In fact, the school district was one of the first in the nation to resume in-person classroom learning after the coronavirus first hit in 2020. But when they did that, there were all kinds of disruptions because if a student or staff member tests positive for having COVID-19, then students in the classroom would have to quarantine and stay at home, or in some cases, entire school buildings were shut down, and that caused major disruptions and caused major problems for parents who either had to stay home or go ahead and pay for childcare. But now the district is taking a new approach. The Stay Safe, Stay Open initiative will aim to keep kids in the classroom even if a fellow student or teacher tests positive. New York State will be giving the district 2 million take-home test kits so that students and staff can be tested at home if there's a positive case in the school or in a classroom. Students who test negative and show no symptoms will not have to quarantine and they can return to school. But every student and adult in a classroom with a positive case will need to take at least 2 at-home tests in a period of 5 days to ensure their status has not changed. The overall premise for the revised approach is to help maintain continuity in the classroom, and everyone involved in the decision maintains that virtual learning has not been as productive as they would have hoped, and that the option to keep kids at home rather than in the classroom is just not a good idea. Now, the city will also be ramping up or doubling its random testing throughout the school district. That's been happening, but now they're going to increase that volume, and that includes any student who is both vaccinated or unvaccinated. They will be subject to a random test as long as the district has parental consent here. Meanwhile, the mayor and the city's health commissioner are still telling parents and urging them to get their kids vaccinated because they maintain it is their best defense against this Omicron variant and any other variant that may hit the city in the future. But the city says this is their best way, the best thing they can do to try and keep kids in the classroom, and they're hoping this new measure, this new initiative and idea will be a successful one. Reporting live in New York City, I'm Dray Clark for BNC.
Dray, thank you for that report. It's like deja vu all over again, buddy. All right, nearly 2 years into a pandemic, it is the last place, right, anyone hoped to be. The number of kids in hospitals, right, with COVID is approaching peak levels not seen since September. Also developing, the FDA says at-home COVID tests might not be able to give positive test results for the Omicron variant. Hospitals, schools, the transportation network, and other institutions now scrambling to cope with it all. Tom Foreman has more.
Nationwide, hospitalizations of children with COVID are up, on average nearly 50% in just 1 week. New York City has seen pediatric admissions jump to 5 times what they were. In Washington, D.C., half the kids coming to Children's National Hospital are testing positive. All told, an average of more than 300 children are being hospitalized each day. That's not because current variants are uniquely targeting them, but because
we see children who are hospitalized because of COVID or in the ICU because of COVID. They're all unvaccinated. They're unvaccinated. The parents are unvaccinated. The siblings are unvaccinated.
Others fear the return to school next week could be even worse.
I think that what we're going to see is once children go back to school within a week or 2 of schools opening is when we're going to see our highest numbers.
Amid the winter weather, the pandemic is roaring across the country, with over 250,000 new cases now diagnosed daily. That's a record.
This Omicron variant is such a game changer in terms of its high transmissibility. It's like this big virus blizzard.
Hospitalizations are only about half of what they were last winter, but some states are seeing peaks there too, and more vaccinated medical workers are experiencing breakthrough cases and being sent home just when demand for their expertise is soaring.
that's still an impossible strain on an already strained healthcare system. So I understand the pressure to get workers back earlier.
The virus is spreading so fast, the impact is now going far beyond the widely reported holiday travel problems. In New York City, Apple has closed all its stores to browsing shoppers. In Maryland, courts are cutting back their winter schedules. And everywhere, health officials are fretting over the long lines for testing.
So I think that that's going to be a significant challenge. And if we can overcome that supply challenge and also the cost challenge, I think that will help us tremendously.